Yo. Yeah. Two dudes on the mic, keeping health in sight. Dr. Goodman and Ben making wellness feel right. From workouts to hacks and science that's real. Dudes talking health, the conversation you feel.
Dr. Goodman, welcome to the podcast. I am
Thank you for having
very
me.
excited about this first podcast of 2026. And we took a break for the holidays, and mine was fantastic. You know, I've been traveling. I'm in Europe right now. I'm actually in Portugal. I hope yours was great. And I know we got to chit chat a little bit before this about the holidays and what we've been up to. But today we're going to talk about something that has been on my mind recently. I have a lot of people close to me that have gotten very deep into both the cold and the hot therapies, ice baths and saunas and steam rooms and things like that. And you know, I haven't yet, but I've been very curious about it, and I want to know the science behind it. And that's why I want to talk to you about it. Ice baths, is it life-changing or is it a fad? And it's very interesting. Earlier on, I had dinner this evening, and I sat right next to some Swedish people, and we were talking about cold therapy and then going to take a sauna and how it's a cultural thing in Sweden. And they had told me about the Finnish people, and I was also thinking about Wim Hof, who's been this master of making cold plunges very popular. And I know it's not a fad for him. He's been doing this his whole life. But this is what I want to talk about. I want to talk about cold plunges. I want to talk about the sauna. I want to talk about the steam room. And I want to know the science behind this. If this actually helps an individual, if there's long-term benefits, and do a deep dive behind it. So Dr. Goodman, good to see you. Welcome to 2026 and the podcast. Yeah.
Thanks,
Yeah.
man. Yeah, I'm super excited. I've been interested as well in kind of diving in a little bit to the hot and cold stuff. And we have a good buddy, Wes, who shared with me a while back, like some studies that he was reading about saunas and heat exposure because we were getting in the sauna after one of our workouts. And it's always been something that it didn't not make sense. You know, I was just kind of like, I wonder what the benefits are. I'm sure they're there, but I just didn't really know what they were explicitly. And so it's been in the back of my mind as well. It's like, is this something to look
Yeah.
into? It seems like a lot of times in the wellness community and in medicine in particular, you kind of have this, well, I've got a medicine that'll do this for you. And then someone goes, well, you know, you can get that with like a cold plunge. And you're like, oh,
Yeah.
okay, but I can do the work or I can get it in a pill. And there's kind of that dichotomy where you're like, look, if I had perfect lifestyle and exercise and all this stuff, I could probably do the same things or get the same physiologic benefit as like this statin or something, you know? And so I think in this realm, it's similar. You have these physiologic benefits and adaptations that occur with heat exposure and cold exposure, which you can get probably from some other things too. Or, you know, maybe with these like the peptide worlds coming together, they're kind of figuring out how to stimulate some of these same pathways, you know, just with an injection or with a pill. And so I think it's kind of cool to see like, man, you know, for centuries, people have been doing these hot and cold things and you know, they've been getting these physiologic benefits and now we, you know, have some pretty good scientific data to back up like what's been happening. I think it's just, yeah, it's fascinating stuff.
So, Dr. Goodman, I want to ask you because, like, I've done a steam room, I've done a sauna, and I've gone into cold places. And for me, the steam room, the sauna it's a lot easier to go into. Like, I actually enjoy it, right? And I want to get to that second, right? I want to talk first about the cold plunge and the ice baths and hear about, because in my mind, and tell me if I'm wrong, it's a physical and it's also a mental thing. And I first want to talk about the physical piece of it, right? Is there any science behind what an ice bath actually does for you and how it helps you out physiologically?
Yeah. The answer is yes. So big bird's eye view kind of way to frame it real quick is that your body is trying to manage to keep itself in a kind of a generally like a neutral state, you could call it. Like our body functions
Homeostasis.
well at a certain temperature, right? Certain pH, certain whatever you have there, right? So we call that process homeostasis, that always that pull back to the middle. It doesn't mean that the middle is by virtue of itself optimal. It just means like, like it's not going to work as well if we go to one extreme or the other. But every once in a while, you got to, you know, toe over to these other sides to get certain things done, right? You got to kind of exercise your fight or flight system to get in and out of dangerous situations. It's beneficial to you. That doesn't mean you want to live there. You got to kind of eventually make your way back to the middle, right? So you need your fight or flight response. You need to step into that response to get out of a dangerous situation, to respond to stress, right? And to function normally. But you don't want to live over there, right? Chronically. You want
Yeah.
to bring it back to the middle at some point. And you want to relax and, decompress and, rest and digest every once in a while, but you don't want to live there either. That wouldn't be beneficial to you. So homeostasis is just the ability, I think, to remain relatively neutral, but also there's some autonomic flexibility that your body benefits from having, from being able to switch on, switch off, and move between those states. And a good way also to think about cold and hot, since we're talking about temperature, is your body is sort of if you wanted to really generalize it, you kind of have like a core temperature or a core body area, and then you've got kind of a peripheral body area. So we would call that like skin temperature. And these are constantly in like a give and take. And sometimes obviously they're probably about the same. But when your body is stepping into a cold environment, you're going to respond in a way that takes circulation to the most important parts of your body in the core. So your vessels in the periphery, in your hands and in the skin open straight or to close up, and that will effectively move blood from the periphery to the vital functions, vital systems of your body. So your heart, your
Is
vital
that your
organs, respiration.
is that your body saying, I want to go to like to keep the body alive, I want to pump blood into the most important pieces to keep it alive?
Correct. It's a survival mechanism. It's an adaptation response. It's hearing or it's feeling that it's cold and it's going, okay, crap. If it's gonna stay this cold, I better protect the most important parts to keep myself
Sure.
alive for as long as possible, right? So that shift happens, right? And then in a matter of minutes, I mean, we're not talking long, 10, 15, 12 minutes, the core temperature will kind of follow the skin temperature. So it's like skin temperature will drop, your blood will shift, but eventually you can't just keep up that internal temperature perfectly for like in perpetuity. So that will begin to drop as well. And so your body will then respond again, and it's a little more concerned now because your core temperature is going down. So the physiologic responses that happen to preserve that system, you might call it like a stress response. The cold is the stress, and then your body's responding to the stress. So if we lived in that stress, like we were talking about earlier with the different systems, if we live in that environment, it's not going to be good for us, right? Eventually, our core temp's going to drop too much and cells will die, things won't work. But if we can step into that realm and then maybe come back to homeostasis, the systems that ran while we were over there, they kind of bleed for a few hours. And so you get these positive effects both for a few hours or a few days, and then with repeated exposure, you develop adaptations over time that can all add up to like be very beneficial for your long-term health and risks and stuff. So yeah, that's any questions.
So yeah, I have a lot actually. That's a bird eyes view, and the way I understand it is the body protects the most vital organs once the cold phenomenon happens. Let's say your heart, your liver, everything inside, and the blood is rushing there. And then once you are out of that kind of that fight or flight stress, you have benefits from
Yeah.
what has happened.
So that's just kind of a bird's eye view way to look at what you're doing when you're stepping into a heat exposure or cold exposure. But if you want like the actual science of it, there's basically receptors, right? Little receptors in your skin all over your body. And these guys will pick up on temperature. You have temperature specific receptors. They'll send a signal through your nerves. We call them the peripheral nerves, right to the back side of your spine. Like on the back side of your spine, it's called the dorsal root ganglion, and dorsal surface or the dorsal part of your spinal column. So these nerves pop in there, they interact with the central nervous system neurons, and they follow a path called the spinal thalamic tract up to your brain. And that basically, you could say ends, but kind of ends, I guess you could say, in the hypothalamus. The hypothalamus is kind of your temperature regulator. It's your internal thermometer. And so it senses the change in temperature, and it begins to send out some messages to your body. So mostly it sends out catecholamine, so that's like norepinephrine, dopamine, and that will give you the effects that we talked about earlier. It goes into your peripheral system and vasoconstricts your vessels. It will send messages to your muscles and begin a shivering response. And that shivering is to generate heat. Just like you get hot when you're working out and doing stuff, that's your body's, hey, let's get some shivering going. and generate some heat to keep my core temperature as close to homeostasis as I can. In addition, you activate a very metabolic tissue in your body called your brown adipose tissue. And the brown adipose tissue is slightly different than white adipose tissue, which we normally think about when we think about fat. It's less fat storage and more metabolic efficiency. So when you have sugar in your bloodstream, brown fat is very, very good at getting the sugar in. It's very insulin sensitive, super good at it. So it gets that sugar in there, it uses it to build triglycerides and to build the fatty acids inside the cell. And then it burns those fatty acids in the mitochondria, just like you do in other cells.
Yeah.
Except that instead of making ATP at the end, it's decoupled from that process. So instead of making ATP, you just generate protons. And the protons leak out of the mitochondria, and the proton leak, that decoupling that results, in that, it generates heat by itself. So you literally have these little internal heating tissue called brown adipose tissue. But as you can kind of infer, it's really good at capturing sugar. It's really good at burning fats and lipids. The more of that tissue that you have, the more overall metabolic health you can enjoy, right? You're more insulin sensitive. So if you get I get a hit of carbohydrates or sugars, your body can handle it more. You have more of that tissue that's very efficient in drawing it in. And so you get less of the metabolic risk that comes along with things like diabetes when you become really insulin resistant. So having brown adipose tissue around is good because it's thermogenic. And when you get cold, you're going to get some heat. But it also just so happens to be very metabolically efficient. And so you enjoy those benefits as well. So that's one other thing that cold does. It will activate that tissue.
And that increases your metabolism.
Yeah, and then essentially you're just increasing your basal metabolic rate by doing that. I don't know how much the basal metabolic rate increase is like beneficial for, like, if you wanted to be on a real weight loss journey. Obviously it's going to help you, but I think about it less like, oh, I want to lose weight, I better get some more brown fat. It's more like, well, I want to have very efficient metabolism. I want to enjoy the benefits of high insulin sensitivity, and I want to be able to manage my blood sugar really well. And then in addition, brown fat secretes other factors, right? It's fibroblast growth factor, neuroregulin. Neuroregulin secretes IL-6, which is an anti-inflammatory cytokine, secretes adenosine, which contributes to anti-inflammatory processes, and it's angiogenic. So it's brown fat is more like a tissue. It's more like an organ that responds to this stressor, and it's a metabolically efficient and active organ. And so I think when you want to have metabolic health, a lot of times we say, well, we need to get really good at burning fats and really good at managing sugar. And so we say, well, muscle is good, right? Because I exercise my muscle, and so I can manage more sugar or manage it easier. And this is the same way. It's like the more of that tissue you have, you got another tissue that helps manage sugar and also generates these really beneficial cytokines and other substances. And so you get that positive benefit from it too. Another great effect of this response, you might call it the stress response, goes up to the hypothalamus, is it's going to activate your sympathetic nervous system in total. So you get the vasoconstriction, your heart rate's going to go up a little bit, right? Your blood pressure is going to go up, but you get a little jolt of catecholamines from like your adrenal glands, right? More norepinephrine. So you get like focus, attention, alertness, and that doesn't seem like a
That's
positive,
more the mental side.
yeah, but when you come out of a cold plunge and the people are like, I just feel fantastic, it's because they've got that increased focus, alertness, attention. And so in addition to that, you've got dopamine in your system, right? A dopamine surge that can last for, a few hours. And so you feel better. You're just, the sense of well-being is there, sense of focus and attention. So in a way, there is kind of a blend of like immediate benefits, like immediate effects that you feel right now that last minutes to hours. And then I'm not going to tell you that there's long-term benefits from like a single session of cold. It's not like you're just going to be like, oh, well, I just shifted and now I've got more brown fat and now I'm just more metabolically efficient. But you can see how with repeated use, with repeated exposure, you're going to eventually garner the long-term benefits from it.
Yeah, that's the case you were talking about, the dopamine increase and all the mental pieces. I've talked to friends and people I work with that do cold plunges, and they talk about a feeling of euphoria after doing a cold plunge. First question is, how long should you do a cold plunge for if you're going to do it?
Yeah, so those euphoric substances are called your endorphins, which is basically just shorthand for endogenous morphine-like substances. They're just internal opiates. So that's why you feel so good. And
Hmm.
so the recommendation right now, at least from what I can garner from the studies and from experts in the field, is that you do like about 11 minutes per week of cold
Okay.
exposure. And at one single time, you do like 1 to 2 minutes. You get it around like 10 to 15 degrees Celsius. You get the exposure for 1 to 2 minutes. And then in total, 11 minutes or so per week to get what you might call measurable effect or measurable benefit.
Gotcha. Okay. What happens if you go over 11 minutes?
Probably the cumulative downsides that we talked about, where like you're obviously spending probably too much time in that environment, would begin to accumulate. So you might start to hurt. Like if you're in there for too long, it's probably less about the 11 minutes and more about like the 1 to 2 or 1 to 3 minute window. Like if you're in there for 5 minutes, eventually you're just in a hypercortisol state and you're just in that state now. You're just kind of living in it. You don't get the beneficial effects. Now you're starting to get some of the detrimental effects of just constantly having that system on. And once you enter crossover from acute to chronic, like inflammation, acute to chronic, you start getting into chronic disease and chronic, dysfunction. And so I'm not sure what exactly would start to break down right away, to be honest with you. I mean, obviously, you could develop hypothermia if you're in the cold for
Yeah.
too long.
Yeah.
So you don't want to get that. But I think it may also be that maybe you don't have a ton of adverse effects if you're doing 1 to 2 minute sessions. Let's see, maybe 2 minute sessions 3 times a day for a week. That would be well above 11 minutes.
Yeah.
Maybe you don't have acute damage to your tissues, but maybe you just don't see any more benefit, right? Past 11 minutes, you're not getting any more of the beneficial
Okay.
effect of it. It's the kind of like the stimulus needs to be just the right amount to get the stuff. And then as it tapers off, you can hit it again and then tapers off, hit it again. And so I think that's probably more the idea. Like just there's no added benefit seen for spending 25 minutes in the cold over the course of the week.
What about, I mean, we talked a little bit about the mental piece, but I want to dive a little bit deeper into any mental benefits. And obviously, you talk about dopamine and your endorphins increase. And I've talked to people that have this, anecdotal euphoric experience when they do cold plunges. Are there anything is there anything else in terms of the mental piece? I mean, other than just pure focus, because if you're in a cold place that long for a couple minutes, you're going to be focused on hopefully anything other than the pain. Is there any scientific piece of a mental benefit that you get from it?
Yeah, probably just one additional piece. So I think it's pretty self-explanatory that if you get a sudden burst of catecholamines, that can be focus, attention, alertness, arousal, and also some pleasure, right? With dopamine, with the endorphins, those neuropeptides are going to give you that sense of well-being, euphoria, that feel-good sensation. But over time, with repeated exposure to stress, your body adapts. So at first, when you start to do these plunges, you might be really uncomfortable. It doesn't mean you're in like a lot of pain or you're getting frostbite, but you just hate it. It's very
Yeah.
stress inducing. Your heart rate just spikes. You just, oh, I hate it. But over time, your body just learns to cope better with the stress. And so that's not to say that you don't get benefit from it repeatedly or that you have to go longer or go harder, but you just develop this resilience as a human being. So it's less stressful to you, but you're still stimulating the neural pathways, right? The temperature sensors are what they are. They're going to respond to the drop in
Hmm.
temperature. They're going to signal the hypothalamus to do its thing. But the experience of it is going to be less jolting to you. And so we can touch on this a little bit too with like heat therapy. But I've heard folks say that like with repeated sauna, and I think the same with repeated cold, that over time you just feel like you're better able to manage stress. You're just more resilient. You're a more resilient person. And so that I think is a huge benefit, especially
Hmm.
over time as we deal with stressful things and you can't predict when they're going to come and go jump in a cold plunge and like feel good for a sec. And so being able to develop resilience within your autonomic nervous system, within the stuff that you don't really control with your mind, being able to be fluid and stuff, I think gives you a sense of well-being, resilience, fortitude, just that kind of thing. But in terms of that euphoric feeling, the mental health benefit, I do think of cold exposure as more like a cup of coffee. You drink it, you're going to feel good or you're going to feel focused. and then eventually you're going to need to do it again. There probably is someone would probably push back on me on that like some expert in the field say, no, actually there's an increase in dopamine at baseline, whatever. And I feel like that's from repeated exposure over time that probably gets that system nice and lubricated. And then there's this combo of like this resiliency that you develop and this mental fortitude and this autonomic fortitude, not physical fortitude, like, oh, I'm so tough. It's just when a stressor's on your body, you can keep your nervous system in check. You're not going to panic. You're not going to jump out of the tub, right? You can handle it. And I think that's important.
Can I equate that to, let's say, us climbing up a hill on a mountain bike and my heart rate goes up to 180, 190. I can still maintain and push. Going through like very tough situations at work or other stressors in my life. It could be physical, it could be mental, it could be, my professional life. Is that the same type of thing where the more I'm exposed to it, the better I can deal with it over a longer period of time? Is that what you're saying?
Yeah, I think so. Yeah. So there's early on in your training when you're starting to do something really hard, it's really tough to get through it. Like
Mhm.
you're just running a triathlon or you're running a long distance.
Yeah.
You have to get through the mental barrier, right? We always talk about that mental barrier where you're just like, I can't do it. And you want to stop. Your body's screaming at you to
Yeah.
stop, go rest. This isn't good for you. This is a stressor. I'm activating systems that are not what I want to be doing. I want to be chilling, right? And so the more you do that, I just think of it almost like the wiring in a car getting cleaned up or getting replaced. The connections to your battery, you clean them off, you clean the terminals, you get them nice and fresh connection in there, nice and solid. You put new oil in your engine, everything's fresh and new. And I think this, just by using it, you develop that fluidity of the system, the efficiency of the system. And your body's really, really good at that. When you place it under stress or you introduce it to a situation or an environment, it's very good at adapting to optimize its performance in that environment. And so I see this as relatively no different.
Yeah. Okay. Well, Casey, I want to segue into heat exposure because that's, for me, it's a lot easier to go into a sauna, go into a steam room. It's more enjoyable. But I want to ask about any physical benefits of doing that. What happens to my body, and what are the benefits for me?
Yeah, sure. So it's a similar system, right? You still got the temperature sensors out here in your skin. They channel right through the neurons back to the dorsal part of your spinal cord up to the hypothalamus, senses the heat, right? So this system, though, the response is just a little bit different. You don't want to constrict out here and bring heat to the core to preserve your vital functions.
Hmm.
You are like, crap, I better get ready to get rid of heat because if I don't, I'm going to boil. I'm going to heat up and boil.
Yeah.
So instead of the constriction and all that, your hypothalamus turns on some GABA. It uses GABA, the neurotransmitter, which we've talked about in previous episodes. It's the inhibitory neurotransmitter for the most part. So that will be released, and it is decreasing the input to the sympathetic nervous system, the fight or flight. So it's kind of downplaying the fight or flight. It's saying, hey, don't vasoconstrict, don't do that right now. Just try to relax a little bit. It increases input to your sweat glands. So you have direct input to your sweat glands via acetylcholine. It's a cholinergic process. Then between those two things, you now have this ability to eliminate heat or diffuse heat out into the environment, right? By sweating, you're taking heat away from the skin via evaporation. The blood flow, the blood vessels in your periphery are dilating, so they're carrying more volume, and that's going to diffuse heat from the blood, the water in your blood out into the skin and then out into the environment. You're just going to radiate heat off. And that's kind of
Hmm.
the core change that's taking place. The similarity though is that it is a stress response. And so your body does also like increase your heart rate. It increases your cardiac output because it's trying to get blood flow to that area. And so
Yeah.
you may have a similar response in that way. Your body's like, hey, I've got to get blood to this certain spot, so I'm going to push it there. So your heart rate goes up, and that is an exercise mimetic, right? That's what happens when you exercise. So
Yeah.
you're basically getting a little bit of like a cardiovascular workout just by getting exposed to the heat. Yeah, it's just trying to get blood where it needs to go.
Can we substitute a steam room or a sauna for going jogging or getting on the treadmill? Does it do the same type of thing?
I don't know the answer to that question in terms of like quantifying uh,
Hmm.
how much exercise or how much work is being done by your system. I would be interested actually in that because my feeling is it wouldn't be the same. I think you're probably
Yeah.
doing better with physical activity, but that might just be my bias. Just like I just love exercise and I think it's
Yeah.
awesome. So I think a sauna or heat exposure, I think of it as like an adjunct, right? It's just like another way to get cardiovascular benefit without having to go out and do the run or the stuff. And plus, it's not like your body is just like, I need cardiovascular benefits. I'm going to generate some heat or I'm going to dissipate some heat right now. Like, that's not how it thinks. I think it's just an effect. It's just a result. The fact that your body's having this response, it just means that your heart's working harder. And that means that the heart has to pump more efficiently. It has to get better at its job. And that's going to give you cardiovascular fitness, right? When you're exercising, your heart has to pump blood. It has to get better at its job. It has to be more efficient. And therefore, you're going to
Hmm.
enjoy some cardiovascular fitness. So, whether those two are equal, I'm not sure. I don't know the answer to that question, and it'd be interesting to quantify that. But they do see an improvement in VO2 max in people that utilize heat exposure therapy after their workouts. They do see
Oh,
an
wow.
improvement beyond baseline, like just the workout versus just the workout and heat. They do see an improvement in VO2 max.
Is that like what quantifies for that? Is it just a sauna, steam room? Could you go in a hot tub, or like what do you need to do to quantify that?
I think that you need higher temperatures, probably. I think the sauna is probably the most bang for your buck because I think if I've, I'm not sure that I've seen sauna versus steam, but I do know that humidity plays a factor because obviously if you're
Mm,
in a dry environment and you're sweating, you're going to have a different dissipation of heat than if you're in a humid environment and
sure.
you're sweating and unable to do that. So I know that they know how to quantify the right dose, you could call it, of heat based on how long you're in there, what the temperature is, and what the humidity is. They can take those factors and be like, for a sauna, dry heat, you need to be in there for, this amount of time at this temperature, this many times a week. And so they do know that. But, off the top of my head, I couldn't tell you like exactly, which one's better or if it still does it. I have to assume that if you reach the temperatures, your body's going to respond. It's going to send the signal to the hypothalamus and it's going to generate the same response as you would, with anything else, but maybe more efficiently over a greater time. Like with infrared saunas, I was listening to a podcast that said that she thought that it was like double the time. You needed to be in there for like 40 minutes versus 20. It's just
Oh, okay.
something about that infrared sauna just doesn't get the temperature up quickly enough or to the same extent. And so I think that varies. A little bit above my pay grade with the specifics on that one.
What about the mental piece, Casey? We talked about the mental piece of the cold exposure, but what about
Mhm.
heat exposure? Is there also benefits on the mental side?
Oh yeah, totally. So heat exposure also generates endorphins, but it also generates prolactin and it gives you a growth hormone pulse as well. So it's kind of like a different pathway, but it's still similar substances, still endogenous opioids or and opioids in your body that you make yourself. And the opioid pathway and the serotonin pathway are activated in the hypothalamus during the heat response. So you've got serotonin, you've got opioids essentially in the system, and then you've got growth hormone and other, prolactin and other hormones that are released that do generate that feeling of well-being, of calm, of happiness. And if they do not let me get out of the next hot shower, you feel good, you're gonna, yeah, I'm just gonna nod off and go to sleep. I don't
Hmm.
necessarily know that, there are growth hormone benefits to sleep and stuff. I think it's like a relaxing event. I think that's what kind of sends you that way. But yeah, you get a nice mental, what's the word? You get a nice little burst of these well-being chemicals, these feel-good chemicals in the acute period after a sauna. And so that can make you feel really nice going into a work day, right? I think if you
Yeah.
were to do that and then you go to work, you feel relaxed, you feel good, and I feel, people perform well when they're relaxed and they're in the pocket and they're feeling good. And then because it's a stress response, again, you're lubricating the stress response system, which makes you better able to handle stressors. So I just feel like the mental fortitude, the physiologic fortitude and resilience also plays a role here as well.
Awesome. What about mixing them? What about, like I said earlier on today, I was at dinner with a Swedish family, and I know the Finnish people, they'll mix them, they'll go into the sauna, they'll jump into the ice bath, and then come back into the sauna. And I know that is prevalent in Russian culture and different cultures, mostly in Northern Europe, but I know there's some places in the US that do that as well. Do you know any science behind mixing those two, or is that kind of just
Yeah.
along the same lines?
No, I would say that mixing the two, probably from a few different standpoints, can have benefit. But to zoom out just a little bit, heat seems to lend itself to a little bit more of a slower, long-term adaptation. So much like exercise, it's more like improving your fitness for the long haul. Even though
Hmm.
the effects are generally minutes to hours to days or something, it seems that the system that it taps into and the things that it promotes prep you just for more long-term, like longevity, health, and wellness. So the
Hmm.
exercise mimetic portion, the increase in VO2 max, the increase in cardiac output, but not only that, long-term dementia risk that has been explored with heat exposure therapy. So one thing that we didn't talk about before, which is really crucial, I feel like, for heat therapy, is the release of the heat shock proteins. So you've essentially got these proteins in your cells here who are hanging around attached to uh, a heat shock factor. Okay, there's these two little dudes that are hanging out together, and these heat shock proteins, their job is essentially to shuttle deformed protein to be repaired or discarded or whatever it is. They're there to handle proteins that have become deformed. Either they were formed that way, they just got misfolded, they got messed up in creation, or you got too hot and it denatures, it unfolds, right? So that's what we know heat can do. So when you get a heat stimulus, all of a sudden there's lots of different proteins floating around that have become denatured as a result of the heat that you've exposed yourself to. And those denatured proteins will come in and actually compete to attach to the heat shock proteins that the chaperones, right? They're like, all of a sudden the chaperone's
Hmm.
like, holy crap, I got a lot of denatured proteins around here. I got to go handle these dudes. So the heat shock factor is now free and hanging out. He goes into the nucleus and he signals to the DNA in there that they need to transcribe more heat shock protein. And so as a result, from a heat exposure, you get this response where heat shock proteins begin to come out and flood the system. And so immediately they're cleaning up all those proteins that got denatured from the heat. But if you step into the heat for a long enough time to get that response and then step out of it, now you've got these heat shock proteins hanging around for a few hours. And what are they going to do? They're going to do their job. They're going to clean up proteins. So guess what? One of the theories of dementia is it's abnormally folded or misfolded protein. So heat shock proteins are thought to have confer a diminished dementia risk. So
Wow.
you get that as well. So with repeated exposure, you're kind of just cleaning up abnormally folded proteins in your system, and that can confer long-term cognitive benefit. We talk about mental health and cognitive benefit. I mean, that's
Yeah.
huge, right? So it seems like heat, even though I can't really give you a really good explanation as to like how the benefits are more long-lasting, it just seems like when you do heat exposure, you're really focused on like longevity, cardiovascular benefit, and you do get some immediate benefits too. You do get some relaxations because you're relaxed and feeling good.
Yeah.
But it's really more about like longevity, like wellness in the long run. You've got the SERT activation, certain FOX gene activations with heat. Again, you're just more stress tolerance, more autonomic flexibility. And then with cold, it seems more like an acute thing. It's like a cup of coffee. It's like, I'm inflamed. Let's get the inflammation right down. Let's just cool it off.
Hmm.
Just freeze it off. And then as a result, you get the focus and the attention because your body's in kind of like a fight or flight response. And it's like, hey, I need metabolic activity. So
Yeah.
activate all the brown adipose tissue that you got. And then if you do it over multiple occasions, your body's gonna develop and grow more brown adipose tissue. Some of your white adipose tissue can actually you can start to develop brown adipose tissue within it. So you kind of like the brownification of your adipose tissue over time so that your body's like, it's just a natural response. It's just gonna build more of that machinery the more you expose it. So it seems like cold is great for like post-event recovery,
Yeah.
but you're not gonna probably go do a real great chest day and then go step into a cold plunge because you're just gonna take away the build response, that you get from the exercise. But if you couple heat with the exercise, it kind of like keeps some of that stuff going, right? You get the growth hormone pulse, you get a few of these other things, you get the VO2 max component that's a benefit. So it's kind of like how you use them is just a little bit
Yeah.
different. So it's not just like heat, cold, heat, cold, heat, cold. That's the benefit. I'm sure there is some, like the
You gotta be
autonomic
smart about it.
flexibility. I feel like the autonomic flexibility you get from transitioning from one to the other is really beneficial. And in some ways, it's the change that stimulates the response, not necessarily the temperature. So, like, yeah, there was a great podcast episode with Dr. Soberg from Denmark, and she was saying that even hands in cold water, they can detect activation of your brown adipose tissue. Even stepping outside in a colder environment, like in the fall, as winter time comes, you step
Yeah.
out into like in a t-shirt rather than a sweater and bundling, and it prepares your body for the winter. You
Yeah.
activate some of these tissues, even with just the change in temperature. It's not necessarily getting it down to that extreme temperature for a minute or two. So cold, again, acute benefits, recovery, anti-inflammation, focus attention, and increased metabolic efficiency. So over time, I think you get long-term benefit from that. It just seems most useful in that way. And then heat is more like add this to your workout and it's going to confer long-term cardiovascular benefit, dementia risk, improvements. And of course, the flexibility, the autonomic flexibility and that kind of stuff too.
Casey, as you were talking about some of the benefits of both the cold exposure and the heat exposure, in my mind, I was thinking about which segment of the population would benefit the most from each of these. And indulge me for a second. I'm going to say from the cold exposure, it could be an athlete that might want to reduce inflammation, like maybe a pitcher that wants to has an inflamed shoulder, or an athlete that has obviously some kind of inflammation. And when you were talking about the heat exposure and you said it helps with dementia, I was like, holy cow, someone that might be predisposed to like a dementia or Alzheimer's would really want to do the heat therapy. That is that is what I inferred from what you just said. Am I right with that, or is there other examples of the population that you could add to that?
So I think it's kind of like it would benefit everyone because the entirety of the population could benefit from autonomic flexibility, stress, resilience, and those kinds of things, and improved metabolic efficiency. And in theory, the earlier you start and continue with consistency, the more of the long term benefit you get. So it's not like you'd wait for the older fella like myself. And let's say my grandpa had dementia, or a lot of people in my family had it. It's like all of a sudden I'm going to start doing heat therapy to do this. It's almost like
Yeah.
if everybody were to incorporate this in some respect, we would see the rates of dementia probably slow down or diminish
Yeah.
over time. But in the sociological kind of viewpoint, a lot of people are motivated by, oh, well, I'm prone to that, so I'm actually going to go do it.
Sure.
Whereas in another instance, they probably wouldn't. But I do know that, like, in some of these Nordic countries, cold water swimming is very much a part of the culture, like you were inferring
Yeah.
in like the Russian Orthodox tradition or the Eastern Orthodox tradition. There was like a ceremony. It was like a ritual cleansing or a ritual blessing that everyone would go and take a plunge, and it was like a religious rite. And so it's very much built into the culture, and little kids are out there dipping in the water. It's super cold, but
Yeah.
they're dipping in. And one of the studies that was very interesting from Dr. Soberg was the study she did in wintertime swimmers. She essentially went to find people that just loved wintertime swimming. They would do these winter swimmers. And she studied them, like novices that are new to it, and then people that have been doing it for a while, and tried to see, what the differences were. And she was able to see that they had more activation of their brown adipose tissue in like the veterans, but increases in insulin sensitivity, lipid profiles, but essentially like, blood sugar clearance, IL-6 levels, right? So anti-inflammatory levels. Like she sees increases in both groups, but the veterans had kind of like a bit more of the effect already, right? They already had a little more brown adipose tissue, and they were already getting the cardiovascular effect. They were already benefiting from
Yeah.
long-term cardiovascular risk mitigation because their metabolic profile was healthier. And so it's kind of like the earlier the better and the longer the better in
Yeah.
terms of repeated exposure. But sociologically, if I'm a doctor and I'm like, hey, you really could benefit from doing some cold plunges or some of this, to prevent this disease, I suppose I could target some people. It seems like for performance people, like just interested in health and fitness and wellness, I would say that the main use is just like what you described. So if I'm a lay athlete, I could get some benefit from a cold plunge every day. That'd be totally good. But I also know that I'm not going to do that right after I work out. I'm going to do it after
Yeah.
an event because I know that it's anti-inflammatory and good for acute recovery. And when I'm doing it in the morning, right? Maybe after my hot shower because it feels good to do both or something. I know that I'm doing it for like the focus, attention, and then trying to build up some, brown adipose tissue for metabolic efficiency, into the future, and it feels good. Interestingly enough, last point on that, layering and going back and forth with heat and cold. One of the issues that, again, I keep referencing Dr. Soberg, but it was just a really fascinating conversation that she had.
Yeah.
Her principle was to end on cold, not end on heat, which is kind of difficult because heat feels so nice, coming out of like a cold
Yeah.
place and just go take a warm shower and then you're nice and relaxed. But it seems like cold was like a workout that you got that your body was having to recover from, and the recovery from being cold, like heating yourself up, is kind of like a workout for the system, right? That's the beneficial part. But
That makes sense.
if you go and heat yourself up right after a cold incident, then you're not really encouraging your body to do it on its own, right? It's like, hey, I'm hot again. Okay, you're good. Don't go activate all that stuff. So her recommendation was to interplay them, like cold, hot, cold, hot, cold, hot, and then end on cold or something. Like just sandwich the hot in there.
Cold.
And then I think that you could probably make a pretty good argument that you're getting some really good benefits from both, because the heat is this kind of deeper, longer lasting, slower effect, but you're ending on something that gives you the maximum benefit of those cold exposures.
Awesome. Casey, this is fascinating stuff, man. Anything else? Any big picture stuff you want to talk about in terms of ice baths, heat exposure? Because we covered a lot.
Yeah, no, I think, again, I think if the hardest part to anything, as usual, is always fitting it into your day, right? How do I actually practically apply this? And that, I think, is very individual. So, I have yet to find a one size fit all for that. So that's going to be the tough part for things. But I think we can very confidently say that we see benefit from these practices. It's just whether or not you can make the time and fit it in, and in a real world scenario that becomes difficult to do. So that'll be the challenge for everybody. But certainly the benefits are there. They seem very clear. And pretty cool stuff.
Casey, this is fascinating, man. Thanks so much for spending the time and educating me on all of the benefits and I guess mental and physical for both the heat and the cold exposure.
Sure. You got it, man. It's been fun.
Awesome, dude. Thanks.
Yo. Two dudes on the mic, keeping health in sight. Dr. Goodman and Ben making wellness feel right. From workouts to hacks and science that's real. Dudes talking health, the conversation you feel. Two dudes on the mic, keeping health in sight. Dr. Goodman and Ben making wellness feel right. From workouts to hacks and science that's real. Dudes talking health, the conversation you feel. Two dudes on the mic, keeping health in sight. Dr. Goodman and Ben making wellness feel right. From workouts to hacks and science that's real. Dudes talking health, the conversation you feel.